Thank you for taking the time to watch these videos. SolarX Pharmacy Review Program has created these videos to help candidates prepare for the qualifying exam Part 2. You are now going to watch a scenario followed by a quick review with the pharmacist.
Hi, my name is Julie. I'm the pharmacist on duty. How can I help you?
I'm just here to pick up my medicine.
Sure, not a problem. Just to reassure you, everything we discuss is private and confidential, so everything stays between you and I. And before I give you your medication, I'd just like to ask you a few questions about your medical history to make sure it's the most appropriate medication for yourself. Is that okay?
Not a problem.
What was your name?
My name's Jessica Anderson.
Oh, okay, great. And I have your profile on file here. Is it okay if we review it together?
Not a problem.
Okay. So it says here that you are taking Lipitor 20 milligrams once a day. Is that correct?
Oh no, the doctor discontinued that. I was getting really bad muscle pain.
Oh, I'm sorry to hear about that. So we'll address that very shortly. Just before we get to that, are you taking any other medications?
Maalox?
Maalox? So
Yeah.
that's an over-the-counter medication, is that correct?
That's right. For acid?
For acid. And how often do you take that?
Maybe 3 or 4 times a week.
Oh, okay. That sounds good. Any other medications, any herbal products, any natural products, multivitamins?
No, nothing like that.
Okay. And also because lifestyle can affect the way your medicines work in your body, I'd like to ask you a few questions about that.
Okay.
Can you tell me about your alcohol consumption?
No, I don't drink.
You don't drink. What about caffeine consumption?
Also, I don't do that.
No. And what about exercise?
I try, but it's fairly infrequent.
Okay. And what about any smoking? Do you smoke at all?
Not a smoker.
No. Okay. Let me just record that. And sometimes in females, medicines can have different effects if women are of childbearing age. Is there any chance that you're pregnant or breastfeeding?
Oh no.
No. Okay. Okay, so I do have your prescription ready for you. I'd like to review it with you if that's okay. So you've been prescribed Crestor 10 milligrams at bedtime. The chemical name for Crestor is rosuvastatin. And the doctor, like I mentioned, has suggested taking it at bedtime. So it's 1 tablet before going to bed. You can take it with or without food, it doesn't matter. However, sometimes it can cause a bit of an upset stomach. So if that happens, you can take it after taking some food.
Okay.
When you were taking the Lipitor, if you remember, there was a restriction on grapefruit juice because there was an interaction with grapefruit juice. That's not the case with Crestor. So just so you know, you can take it with or without grapefruit juice.
Okay.
Some other things in terms of side effects. So I know you had the muscle pain with the Lipitor. Generally, patients who have had muscle pain with Lipitor do a lot better when they switch to a different medicine within the same class. So Crestor should be okay, but unfortunately there's still a small chance that it can still cause muscle pain. So if that happens, I would suggest that you contact your doctor as soon as you can. There's also a very rare but important side effect that it can severely affect your muscles, in which case you may have dark or dark brown pee when you go to the washroom. So if that happens, I would advise you to call your doctor immediately.
Okay.
Like I mentioned, these are rare side effects, but it's just important for me to mention for you. Because it's the first time that you're taking the Crestor, there's always a small risk that there might be an allergy. It's not common, but just in case it happens, make sure to watch out for anything after the first dose, and you can either call us or call your doctor. And then you mentioned that you were taking the Maalox 3 or 4 times per week. So there's actually an interaction with Maalox and Crestor, the way it's absorbed. So it's still okay for you to take the Maalox. It's just important to space it out from when you take it compared to the Crestor. So there are also some lifestyle changes that you can make that can help make improvements in your cholesterol levels. You had mentioned that you don't exercise that much, so exercise can be a key component in improving your cholesterol. So if you can, maybe try adding in 20 to 30 minutes of exercise a few times per week to start off with. And then also diet is very key. So in terms of diet, I can actually refer you to a dietitian and you can speak in further detail about ways to optimize your cholesterol levels. Is that okay?
That'd be great.
If it's okay with you, I'd like to maybe give you a call in a few days just to see how you're doing, that you're not having any more muscle pain, and then we can speak in about a month's time as well to see if there's been any improvement in your blood work.
Oh, that'd be great. Thank you.
Okay, have a great day.